Hello everyone, my name is Dr. Tamisha Denis, and today we're going to be talking about implants on your front teeth. There are different reasons why you might need a dental implant to replace your front tooth. I'm going to talk about one of the most commons, even though there are a lot of different reasons, but some of the most common reasons I hear and reasons we decide to do a dental implant to replace a front tooth. One of those first reasons are trauma. Now, trauma is not always something you remember. Sometimes people can remember having a car accident. They can remember having a fight. They can remember being hit as a child in their mouth. They can remember a sports injury in which they fell, or they just had an accident, fell in general. So trauma can be known or unknown. And most of the time when you see a tooth that is dark in the front or has discolored or has been bonded on multiple occasions, usually that's because some sort of trauma has happened. And that trauma can sometimes be fixed with a root canal, but oftentimes if the trauma is bad enough and the tooth starts to get infected, the tooth needs to be taken out, and a dental implant is probably a better, more permanent solution. Another reason that people need dental implants in the front or to replace their front teeth is a bad root canal. Again, sometimes you have all the kind of different traumas that happen to the tooth, and the previous dentist root canaled the tooth. They put a post in the tooth, which I can show you in other videos, and the post basically means there's not much tooth to begin with, so they try to make the tooth taller by placing a little silver screw inside of the tooth that's not inside your jaw like a dental implant, to make it support a crown, and then the whole thing kind of just collapses and breaks down, and then there's nothing left. So now we have to pull the tooth and think about putting a dental implant instead. Another reason is if you have a bridge. Again, if you have a bridge that kind of goes all the way across and those teeth underneath the bridge starts to break down, then you would have to shave more teeth in order to replace the bridge. So placing a dental implant is a much better permanent option instead of continuing to break down teeth and link them all together in order to place another bridge that eventually will need to be replaced. Another more uncommon reason, but I do see it often in my teens, is maybe you never got that tooth. A lot of times the lateral, that's not the two front teeth, that's the next teeth over. You just plain didn't get it. So the baby tooth stays there and the adult tooth never came down and pushed that tooth out. And if that happens, then we need to consider putting a dental implant instead, because you're just never going to get the adult tooth. If it's a back tooth, a lot of times I'll tell my patients, listen, take really good care of that baby tooth, because if it ever comes out, you're not going to get a replacement. You will not get a second chance. And that's when we'll discuss placing a dental implant. But in the front, it's a lot different. You don't want that tiny tooth sitting next to all of your bigger teeth. So a dental implant is the best way to replace a tooth that you just never got. So those are some of the most common reasons that we need to place a dental implant in the front. Now let's talk about what's the procedure. The procedure is not that much different than placing an implant in the back. The only difference is the fact that we need to consider the temporary. And the reason that the temporary is so important, if my front tooth, this one, that one, anything in the front was missing, I wouldn't want to walk around for 3 to 4 months during the healing period of the implant while the implant is under the gum, spending time to become a part of my body. I wouldn't want to spend time smiling with no tooth in the front. So what we put in the meantime is very important. Okay, one of the first options that we think about placing in the front is called a flipper. Now a flipper is basically a pink plastic piece or acrylic piece that has one tooth attached to it, and literally you just snap it into place and it looks like you have a tooth in the front. They actually look really good. They don't look so terrible, but they don't function very well. And when I mean function, I mean it makes it not so easy to eat with, because when you bite down you have to be very careful. So social situations can get a little sticky, because now you know your front tooth is attached to a piece of something and you kind of have to be very, very, very careful. So one of the second ways that we can put a temporary in the meantime while you're waiting for your implant to be healed is sometimes, depending on the condition of the tooth next to the place of the implant, is we can bond a little fake tooth between. Now that is almost like the teeth are linked together. It's not always the nicest looking thing because you can see a little bit of stuff stuck between your teeth, but functionally it's a lot better. You don't have to worry about this thing constantly coming out, or you taking it out and putting it on the side because it's stuck inside of your mouth. But again, there's going to be no corn on the cob and apple chewing for the next 3 or 4 months until that implant is healed, and then you can eat whatever you like. Another kind of device that we use sometimes is some sort of, we call it an Essex device, which looks like an Invisalign retainer or tray, and we put a tooth inside and you snap it on, and it has a tooth inside. You can smile. People just look like you're getting some Invisalign done, and they don't really know what's going on. It's not very easy to eat with. However, it looks pretty good. It just looks like you have an Invisalign tray. Some people do choose to not wear anything, which I think is kind of funny. But, you know, depending on how your lip line is, and if you can hide the fact that you're missing a tooth for a few months, then that is something you can do. There are options to put a temporary crown directly onto the implant, but that does cause a lot of issues that are not worth sacrificing healing time to do. So that's something that we can discuss and decide which temporary option is best for you. Now, I always caution my patients because I give them a flipper or something like that, and they say, "Ooh, I don't like this thing." And I say, I know. And I know because if I thought that you would be happy with something removable, that is what I would give you. But I understand it to be temporary. Temporary is the key because the dental implant is the most prime option. Again, it's just like you. You don't have to think about it. There's nothing to remove. There's nothing to think about at all. You just have, I put it in, and that's the end of the story. Now, those are your temporary options. Again, that's something that we can discuss in particular to see which one fits your lifestyle the best. Now, when it comes to the procedure of the dental implant, it's not much different. First, and I love to use this little model a lot in my office, and let's see if we can get this really close up. If you look all the way to the front there, you can see a dental implant. This is a clear model, so you can at least get to appreciate what it looks like underneath the gum. So most of the time when I have someone who's lost the front tooth, the day that we are pulling the tooth, we are also placing the implant. So on the same day that your tooth gets taken out, we place the implant underneath the gums and we cover it up with the gums. Okay, so you won't even know that anything's under there because that's the healing time. Now, once 3 or 4 months have passed, and we will talk about that depending on the bone condition, then we will place an abutment, and you'll see what an abutment looks like, right? So there you go. The implant is in, abutment is in. We will take a mold for the lab to then make a crown for our tooth. And usually now everything is very accelerated. The procedure time is much more accelerated. When the crown comes back from the lab, then we place a new tooth over top. And there's your new implant crowns, and they usually come out very beautifully. Of course, we choose color and shape and make sure that it matches everything you like. And of course, because it's the front, I spend extra time making sure that you're happy with your new front tooth. I've met so many people who have lived without a front tooth that they've worn on a flipper, which is temporary, which they worn on a partial, it was not the best option. And when they have a dental implant placed on their front tooth, they're so happy to get rid of that flipper and that partial, so they no longer have to worry about their front teeth. They can smile confident. They don't have to worry if something might come out on accident. So that's the procedure of how we place a dental implant. So there you have it. Those are all the reasons that we need dental implants on our front teeth. These are one of the most life-changing implants that I place because it gives people so much confidence in their smile, and it gives them confidence that they don't have to continually take something on and off to replace their front teeth, and that brown tooth now becomes white, or that tooth that once you had to put it into a cup at nighttime now becomes a permanent solution. So if you're interested in dental implants and you want to know how we can help you at Modern Smile and Implant Center to replace any of your teeth, including front teeth, give our office a call and we can set up a free consultation.